So let's look at substance use. You all know, you've been to this entire day and a half at this point, and you know the stats. I've gone to all the substance use disorder ones because I wanted to make sure I wasn't going to be repeating. But I'm really doing perinatal substance use in this one, and no one else has really covered that as much as I'm going to cover it, so I feel okay about that. But we know that it's a big problem, okay? And this is just from 2022. 200,000 pregnant women, or nearly 10% of the national total, reported using illicit drugs, including cannabis. We all know cannabis. I've got daughters of childbearing age. I know their friends. I know who smoked all through pregnancy. Weed. I know who's smoking while breastfeeding. They may not be telling you. And they have to feel trust with you before they do tell you. And you've got to ask it in a very casual way. How about marijuana? You smoking weed? Have you ever smoked weed? Are you still smoking it now? How about cocaine? How about heroin? One time I was shocked because this very affluent woman, do you hear me? Very affluent. And she just said very casually to me while I'm doing the intake, well, I did take meth to get some weight off for a short time a couple years ago. You guys, really, I'm not easily shocked. And I had to stop my jaw from dropping. In my mind, I was just like, well, now that's one I've never thought about to lose weight. Never even delved into that. I've tried every other thing there is. So you've got to ask it casual, and of course, when you're doing intakes, you're also going to ask very, very sensitively when you ask all of you. If you're asking about sexual abuse, physical abuse, emotional abuse, you are putting your pen down, you're looking away from your laptop, and you're doing eye contact, and you're doing it sensitively. Have you ever been emotionally abused? Are you being emotionally abused now? Have you ever been physically abused? Are you being physically abused now? I want you to be with them. You're in the present moment. You're not in a hurry. Have you ever been sexually abused? Did you tell anyone? You're not going into therapy. You're just saying, did you tell anyone? Have you ever had therapy around that? Some people will answer me, yes, I have, Birdie, and I don't want to talk about it. That's fine. Yes, I did tell. It was my stepdad, and I told him my mom didn't believe me until she found us. And then it was my fault that their marriage broke up. Now, I'm not going into therapy on that right now. I have that information. I also have the information of whether they're in recovery and what are they doing to stay in recovery. Is this new? Some people, the second they find out they're pregnant, and this happened in my own immediate family, someone who was very addicted to crack cocaine got pregnant in the middle of it, and being pregnant with her third child shocked her into caring more about the baby than her addiction. That doesn't always work, does it? No, it doesn't. It doesn't automatic. Listen, I'm going to confess this in front of all of you. I was a former smoker, cigarette smoker. And I was hoping that when I got pregnant, it would be nauseating to me. And I was so ashamed that I smoked during pregnancy. I'm still ashamed of it. I can't believe I did it, right? Other cigarette smokers in here know it's an addiction. And it's so hard to stop. I told somebody the other day, and it's been, over 35 years since I smoked. And I said, I can still remember, I could feel every hair on my head when I quit smoking. It was such a horrible withdrawal. And that's the only thing I have to understand withdrawal, okay? But have some sympathy, have some empathy. Due to deeply embedded societal attitudes, beliefs, and gender expectations for women, right? Somehow it's even worse if you're a woman and you're using. People used to say to me, you smoking, Birdie, you're a nurse. You know better. Did that make me stop smoking? No. Respiratory therapy was smoking too. Let's just talk about it. You know, and you just kind of look at each other like, We are idiots. We really are idiots. But it's much harsher on women well, we're carrying the babies. So it's through pregnancy. It's also if they're breastfeeding, but it's very harsh and it paints it as a moral failing because you're a mom. You know, we have all these, what do we have? Images of mom. Anybody heard the word matrescence? Like 1 in 5 to 7 women will develop a perinatal mood disorder. 1 in everybody that becomes pregnant and has a baby goes through matrescence. It's like adolescence, okay? You become a parent, you become a mother. So matrescence, all of us, but we have this image of this lovely mother. You know, even we all, those of you who have babies, when you were pregnant, you had an image of what the perfect mother would be. I did not have a good mother. That's my own ACEs, okay? I know my ACEs score. You know your ACEs score? You should, if you don't. So we have this image of this perfect mother, what it was going to look like, and it wasn't using substances, was it? So the slides I got are from one of my co-trainers that trains the substance use disorder, Jacqueline Tynan, psychologist out of, so I borrowed their slides. Some of my own, but some of theirs. So I want you to really think about this a minute. Reflect on a time that you heard a client or a patient of yours, perhaps even an acquaintance, a family member, was using substances during pregnancy or during early parenthood. I want you to sit for a minute with it. I'm not making you say it out loud. You know your own thoughts, okay? What's your initial reaction to that? What was it, if it's already happened to you? What was your first reaction? How did you feel? What did you think about or assume about that person? I know in a hospital setting, working in, you heard me say, I started out in cardiovascular critical care. I never wanted to be an OB nurse, never, in a million years. It happened. It's a wild story. I fell in love with it, became lactation, childbirth ed, the whole thing. Now I'm an OB know-it-all. But I watched the social worker every day lead DCS into rooms, every day, several times a day, for substance use. You knew when the social worker was going in with DCS that we had substance use. It went on all day. I worked with nurses with judgment. How dare they? They knew their baby was going to go through withdrawal. Why didn't they stop? I just don't understand this. I don't feel sorry for her at all. I hope they take her baby away. You've heard it. You've all heard it. The judgment. The judgment, the judgment. And sometimes that happens automatically in your head. We need to know our biases and be real about it, okay? And we need to learn, and we need to change, and we need to learn to have empathy for someone else, especially if you've never walked in their shoes. So regarding potential work, providers report that they don't have the appropriate knowledge. We've already talked about this whole 2 days. I don't know what to do with them if I find them. I don't know where to send them. I don't feel like I'm trained at all. And I see substance use disorder as totally separate from mental health. And I'm not even comfortable with mental health. Let's start there. Most of you aren't comfortable with mental health, and then you're really not comfortable with substance use disorder. And they go hand in hand. Number one reason for maternal mortality. I hear one after another in my review committee. And 80% could have been prevented. And we know that. The providers report that they're overwhelmed, they're burdened, and they're fearful. So what do? We put on blinders. We don't want to know it. We don't want to do anything. We just don't ask. There's somehow that if I don't know about it, I'm not as liable. They often the patients themselves describe their experience in the healthcare system as judgmental, disparaging, scrutinizing, disempowering, and it reinforces their tendency to avoid disclosing it to you, right? They delay treatment because they know they're still addicted. They still can't get off of it, whatever it is they're on. And so they delay coming in for prenatal care because they know you're going to ask. They know you're going to draw blood. They know you're going to check urine. They know you're going to find out. And now they have to have that moment of judgment. So they put it off and they continue engaging in risky behaviors affecting the baby in utero. And it's just this vicious cycle. I, one time, went in to see someone with postpartum depression in my role as the perinatal mood disorder coordinator. And as I'm talking to her, she was saying she had to go back to work in 1 week, first of all. Many of us cannot relate to that. I have to go back to work in 1 week. I have no time off. And they're cutting off my methadone. And so I assume I'm just going to have to go back on heroin. My heart hurt when I heard that. I'm just like, because the addiction is there, no one's going to help her. The other thing we used to do, and you all know, I don't know what we do here, but I know in Indiana what we used to do. Finally, it's all changed. We didn't do universal screening for substances. We only screened on those who looked like they might use drugs, which meant your skin color or your socioeconomic status. They didn't screen the sweet, blue-eyed, blonde-haired, middle-class, upper-middle-class person that was pregnant. And then when they started screening everyone, guess who's using? Miss Middle-Class Blonde is using lots of things. And you never would have guessed. Oh, my gosh. Now we screen everybody. The other cool thing we finally did is we used to bring in people to rock the babies who were withdrawing. We would bring in other people to rock their babies. What did we find out? Length of stay is shortened when we let them do skin to skin, the mom do skin to skin, and comfort their own baby, which is what they wanted to do. So they feel your judgment. So how do we shift our frame of reference? Pregnancy is not a cure for other conditions. Just because you get pregnant doesn't mean your mental health gets better and you can go off your antidepressants, and it also doesn't mean that you are going to suddenly give up your substance use. It exists on a spectrum, and it involves complex interactions among your brain circuitry. You know all these things: genetics, the environment, and an individual's life experiences. No one said, oh, I'd like to become addicted. What is an addiction? Definition: chronic relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. It's considered a brain disorder. It involves functional changes to the brain circuits involved in reward, stress, and self-control. These changes may last a long time even after they have stopped, which is why a sober community is so important. The term drug abuse is no longer a preferred way to discuss. One of my family members not long ago, I said something about substance use, and she said to me, is this like a new term? So remember that most people don't know the term. Just like people don't know the term perinatal mood and anxiety disorders, when you're throwing around substance use disorder, most people don't know that term. They know the term drug abuse, illicit drugs. So keep that in mind. So what is an addiction? Per the DSM-5, and therapists in here and physicians use the DSM, it then goes over the 4 different criterion, which is impaired control, social impairment, risk use, and pharmacological, and that's the tolerance and the withdrawal. So you're getting these slides, so you're going to have them all. So scope of the problem, we're looking at alcohol, cannabis, tobacco are the most common substances used during pregnancy. So 4 million births even in 2017, looking at how many babies were born alcohol exposed, tobacco exposed. Prevalence of the births in opioid has quadrupled. We even have changed terms. Instead of saying neonatal abstinence syndrome, and, there's all these terms. And sometimes, there is a 30% of women that were on a SSRI, their babies might have a slight withdrawal from the antidepressants. This is not neonatal abstinence syndrome. And people get that mixed up. Some people think, the babies have to go to NICU, they have to be watched. No, this is like a little jittery. It happens in 30% only, And really, if the mom doesn't stay on antidepressants during pregnancy, she's going to affect that baby in another way by being depressed or anxiety or having bipolar. But that baby, 30% of babies might have maybe more crying, maybe jittery. If you didn't tell them, they might not even notice. I have never in all my years seen a baby have to go to NICU, but I know an OB who every mother who says she's going to stay on her antidepressant and he tries to talk them out of it says, well, then we're going to have to watch your baby in the NICU for 3 days because they're going to have withdrawal. So we've still got the ignorance out there about so much that it drives me crazy. So you see the numbers. Rates of substance use in women and pregnancy. So just looking, and you're getting these numbers, and I know there's a tiny little, in who used it in the past month, age 15 to 44. And you're seeing here alcohol, tobacco, and illicit drugs, marijuana, opioids, and cocaine. So people cite their motivators to stop are feeling ready for treatment, and that takes a while before you're finally ready. I remember quitting cigarettes, and I tried everything. I did hypnosis, and I just remember one day, I cried in my doctor's office and said, I don't think I'm capable of stopping. I feel like I am hooked for life. I'm never going to get off. And I remember one day just saying, this is going to be painful, and you're just going to have to go through it. And I don't know what finally did it, but you got to be ready. You finally said, I really don't want to do this anymore. And for pregnancy, I am worried about baby's health. They know the stats. And concerned for custody. That's big. Significant barriers and unexpected stressors. So again, remember, I assume everybody has trauma when I meet them. Some kind of trauma. It's rare if they don't. 1 in 3 women have had sexual abuse, that alone. And nothing else. So if you don't have any, if your ACEs score is low, consider yourself blessed, okay? What we want to do is we're trying to find right now these parents with high ACE scores and give them resilience and get them healing so that we don't keep raising babies with high ACE scores. So we've got the barriers and we've got to keep working on it. Postpartum period in particular, you just heard me talk. The postpartum period, what we call the 4th trimester, is stressful. You did not know how stressful it was going to be a parent. You thought you were going to play house. And it is not playing house. When that baby comes, when you were pregnant, it was all about you. All about you, all about you. You are unaware how much your life's about to change. That baby comes, and now it's all about the baby. Bonding with baby, taking care of baby, only getting to sleep when the baby sleeps. Learning things that you've never done before. You don't know how to go back to sleep after a baby wakes you up. You don't know how to calm a crying baby. You don't know anything, and we need to say that. You know nothing. So your self-esteem plummets, and this is a really hard time in life, and it was supposed to be fun. And those poor couples who had a baby because they were having marital trouble or relationship trouble, and they thought they'd have a baby to draw them closer together. Oh, dear Lord. It is the highest rate of divorce is in the first year after having a baby. You start fighting over things you've never argued about before. I'm not changing that next poopy diaper. It's your turn. Right? I'm not getting up again. It's your turn to get up. Who's dropping off at daycare? Who's picking up at daycare? Who's taking off when the baby's sick for the day? Who's taking off work? You didn't talk about those things when you thought it'd be fun to have a baby and play house. Who's doing laundry? Who's making dinner? Who's going to the grocery store? Who's doing all these things? I just heard last week from some new mom that said he played lots of video games before a baby, and he's still not stopping doing them. He acts like that he can just still play video games. And I said, well, that's going to have to stop, or this is going to be a major problem. This is one of the most stressful transitions in your life. So put that with substance use. We already put it with mental health. And now if they already had a substance use disorder, but keep in mind, many people start using substances postpartum because of what's going on mental health-wise, and that this is one of the hardest transitions in your life. You are now a parent. You're a mom. You're a dad. You are parents together. You've never been this before. Many times in life, we transition. We have large transitions in our lives, and we are redefined during those transitions. You know what I mean? My husband died 20 years ago. I was suddenly a widow. I was redefined. I had a new name. I wasn't married anymore. I wasn't a couple anymore. I was a widow. When you become a new parent, you're now suddenly, you just don't believe it. I love to go up to people in my own family that after they have a baby and I see them somewhere, I say, "You're a mom." And they always go like this, "I know, I can't believe it." But it's a shock. And ask them what their what-if questions are in their head. They'll tell you. And it doesn't have to be OCD. It can just be, what if the baby stops breathing, right? It's common fears. It's scary. I'm responsible for this little fragile human being. It's not about me anymore. And what they really want to say, that new mom, that new birthing person, is, what about me? My perineum hurts. I'm scared to have a bowel movement. My nipples hurt. I'm not catching on to this. I'm so sleep deprived. But we think it's only going to be happiness. So risk, the fourth trimester increases this, and I've heard so many people that talk about, I started drinking wine every night postpartum to calm down. And I've heard them say to me, I heard someone say that it's okay to have one glass a night. So I just started having one glass a night, and then it went into more. And then I found it really calmed me down. Or I've had many say, my doctor won't put me on an antidepressant, so I just have to smoke more weed. And it helps my nausea, Birdie. And it really calms me when I'm anxious. Or they don't want to go on something, so they say weed does fine for me, for my anxiety. So now their substance use escalates during this really hard time, and now we add more guilt on it. And the risk of overdose and death is even higher now compared to never having been pregnant. It's higher in the postpartum period than never having been pregnant. And it's happening way, way out. And we already know this. I'm just saying the obvious. We already have said it. We come in for a 6-week checkup, and we never see them again. The pediatric care providers seeing them more often than anyone, and they're not asking. AAP says they should be screening. Anonymous screening to the pediatrician says that 46% are doing it. The OBs screen say the public perceives them as the most obvious person checking on mental health and substance use. They say, I don't see myself as that person. So what have we got? Nobody checking, nobody asking. They are on their own, floundering after 6 weeks. Back in my time being pregnant, my mother's time, they thought the placenta blocked everything. And so drinking was okay because the placenta stopped it. Then with the fetal alcohol syndrome, they found out. They went through this phase of, we don't really know how much alcohol is okay, so we're going to say none because we don't know that line. So just don't drink when you're pregnant. Just don't drink when you're breastfeeding. Like I tell people, they'll say, you heard me mention the Indianapolis 500. That's a big thing. I live in Speedway, right by the track. I hear the hum of cars. Common question I get in May from new moms who are breastfeeding is, can I drink all day at the racetrack? What if I decide I'm going to drink all day? Tell me what I can do. And I say, you have to pump and dump all day long. If you are buzzed, neurologically, that messes up your baby. Your breast milk is buzzed, and it should be not going into your baby. So you're going to go down to the bathroom, and you're going to pump and dump all day long. Drink to your heart's desire, but you're not feeding that to the baby. And we've got to be honest like that, okay? Because I want them to be safe with that. But that risk of overdose gets higher and higher and higher. And we know, as I'm on the Maternal Mortality Review Committee, I see how so much was unintentional. Unintentional overdose and suicide are the leading causes of maternal mortality. Individuals in this period are at high risk, And then you see the numbers here that we see over and over. And that's mental health conditions, 26% of death, substance use, 25% of death. There it is again, okay, in bigger. In the postpartum period, at very high risk. And if we've got both partners using in the postpartum period because they're both stressed, I've had people come in and both of them are profoundly, profoundly depressed. And they just look awful. I had a couple came in and they had twins and they both walked in, just looking at them. They were both so depressed and they said, we hate our life. These babies have ruined our life, our relation. They hated each other. There was a lot of work to do. But that's the shock of not realizing that fourth trimester. And then they start using. It starts with the glass of wine, starts with some weed. So the late postpartum period particularly is high for opioid or overdose deaths. And we know that. Opioids and another substance are usually implicated. And like we said in some of the other sessions, they don't know what's laced in what they got. And sometimes that unintentional happens, as we know. And then mental health and substance use diagnosis are present, as we call that, just both things are going on at once. So that fourth trimester is the first 12 weeks postpartum, is what we call the fourth trimester. Disrupted sleep, hormone changes. You heard me talk about how they crash down. And if someone abruptly stops breastfeeding, it crashes down good hormones. And if they already had anxiety and depression, now they're crashing down good stuff, and their anxiety and depression ramps back up again. And they thought, somebody told me, I hear this all the time, somebody told me since I have postpartum depression and anxiety, I need to quit breastfeeding. Well, I don't know who told you that, but you just crashed down good hormones. So if you were enjoying breastfeeding, don't have someone tell you to quit because you're going to crash the good hormones now. But if they're having breastfeeding issues, now we got somebody crying all the time anyway. They're adjusting to new parenthood with a dependent, somebody counting on them. They're touched out. They're touched all the time. Triggering emotional reactions, especially with a history of trauma. Partner conflicts, requirements to return to work, and all the financial stress that comes with buying diapers, possibly formula, all of that. So we've got the self-stigma, then they isolate, and then they're not being treated for their substance use. It just keeps going. And they have an increased risk of overdose and that increased rate of maternal mortality. There have been times we've had to have a therapist come and do sessions with us after our maternal mortality review committee because it was so heavy. And you just say over and over, that shouldn't have happened. That shouldn't have happened. So, let's talk about our ADHD. This is just to know, and some of you I know have it. My daughter swears I have it, and I've been undiagnosed all these years, so I just go, okay, whatever. I'm not starting on something now. The likelihood of developing substance use disorder is high with those who have ADHD, okay? You already know that. High use of using stimulants and abusing them to feel good, especially when we've got ADHD mixed in with bipolar. Similar brain pathways for substance use and the ADHD factors. Childhood adversity adds into this. Impulsivity with the ADHD, which makes delayed gratification hard. I want it now. I want to feel good now. And the attraction hypothesis, which is the preference for stimulating activities to compensate for the low baseline arousal. So treatment of ADHD's got to come first, or they're going to be self-medicating. Psychiatric illness is characterized by persistent distress and re-experiencing traumatic events. Substance use gets used when they had a traumatic event that has never been dealt with. And then, like I already said, you add in traumatic birth on top of that, and they're having anxiety attacks with flashbacks. This is coming in for a birth. Many people have dissociated and suppressed their sexual abuse. And they come in. I have a story of a woman who was doing a home birth and she really wanted to deliver at home. I got called to her room after delivery because she had gone in. She had to have an emergency C-section, goes into the delivery room, and as we do, took her arms out to gently tie her wrists, and she started blood-curdling screaming. And no one could stop her in the operating room. They had to do a general and get the baby out. It was emergent. What did she tell me? She flashed back to being held down in that position as a child and being sexually abused. And she flashed back to that moment, and she couldn't talk. All she could do was scream. She had never dealt with it. It had been stuffed for years. And you can see how that, without treatment, can lead to substance use, especially if you don't get a good therapist, you don't find relief for that in some way. You're going to find relief in whatever substances you can find. Up to 42% of the sample in an inpatient substance use treatment facility, PTSD is involved. Preference of PTSD in pregnancy, those numbers are so low. This is an old number. I told you the latest is 45%. 1 in 2 women saying that something traumatic happened at their birth. And it's in my eyes whether it was traumatic, not yours. Medical illness and chronic pain. What about chronic pain? And I'm not getting relief from it. Am I going to use substances? Yes. Possibility. Possibility then of becoming addicted to it. So chronic pain and medical illnesses that aren't being treated. So ACEs, just a review, you all know the ACEs. Make sure you know your score, okay? There they are. Look it up and do your own, okay? My daughter thought because her dad died when she was 17, oh, I bet I have an ACE score, high ACE score. And I said, no, honey, you don't. Let me remind you of my childhood. That's what you have to have a high ACE score. So early, those with high ACEs scores, you know this, have an early initiation of alcohol use, higher risk of mental and substance use disorder at an older adult, prescription drug use, continued tobacco use during adulthood, and a lifetime illicit drug use, drug dependency, and self-reported addiction. Women who are experiencing interpersonal violence are more likely to have a co-occurring substance use disorder. And that's a whole area to work in. Those who work in domestic violence, God love you, that's a whole area. And you know the numbers. Usually they take 7 to 8 times before they finally leave. Women are reluctant to report the IPV to providers. Those with IPV and substance use represent one of the most underserved, at-risk peoples. So what are the risks of tobacco use? Low birth weight, preterm birth, perinatal loss, sudden infant death, possible increase in cardiovascular birth defects. And anybody who has a baby who's born prematurely goes to NICU, any parent in NICU, especially the mom, what is going on in her head is, this is my fault. And it could be as much. One woman said to me, they told me if I didn't stay on my diabetic diet, because she became gestational diabetes, they told me if I didn't stay on my diet that my baby would have a bad outcome. And it's my fault because I didn't follow the diet correctly. They have guilt. This must be my fault. And other people are saying it to them. This can be substance use to make the pain go away of that. The effects of smoking during pregnancy, placental abruption, intrauterine growth restriction, increased rates of preterm delivery, low birth weight, risk of stillbirth. So alcohol effects, we all know it, but let's look at them. Birth defects, low birth weight, preterm delivery, fetal alcohol syndrome, stillbirth, developmental delays. And yet it doesn't make you stop. You know it, but they don't stop. These are the most commonly used benzodiazepines, and they're also the most commonly abused. There is a place for them to use whilst the antidepressant is kicking in, but sometimes we're so afraid of them. But we really can't use them when there's a history of substance use because of how addictive they are. One psychiatrist told me that Xanax is just like alcohol, like liquid alcohol. Just go ahead and get them addicted on it. Klonopin's a little longer acting, and Ativan. But these are the ones that they're getting on the street. Okay, they have different names for them. Bars. You know, I had to learn all those, like, what? You got to be in the know if you're going to work with clients. You got to know what things are called. You got to know what's really going on. You got to know what we're buying on the street. So with the impact, labor and delivery concerns, increased rates of maternal and infant mortality, we already know that. Developmental delays, impact on the bonding and the relationship, neonatal abstinence syndrome, fetal alcohol syndrome, all the things we just talked about. So how do we get them better? What is the treatment? The treatment is we got to look at what's going on in the family. What are our family considerations? What can we do to heal what's going on? Parenting related stressors. What are they? Can we relieve any of it? Hormone changes. We already talked about that. The big hormone changes, what that feels like, and how unaware I was going to be of what that felt like. And then the co-occurring challenges we already talked about. Whatever other mental health issues, diagnoses that they have, along with increased substance use. You've got a lot to go with treatment. This just shows, it's a very sad graph to showing how many people really got treatment for mental health disorders or for substance use disorders, and it's pretty low. So how do we get them better? We have to have this multidisciplinary, comprehensive services from providers, listen, who hold a non-judgmental stance and tailor approaches. So you should be on there. Lactation's on there, peer recovery's on there, therapists, social workers, nurses, physicians, care managers, legal aid, doulas, community health workers, occupational therapists, physical therapists. We're all on a team together, and we're all helping, and we've got to work on our own issues, our own judgment that we know that we have to get a hold of. So treatment considerations, we need wraparound services, relational care, peer support, harm reduction model. We need to be gender responsive, and we need to be trauma informed. That's a lot, isn't it? These are just some screenings. You've already heard people talk about medications. That's not my area. This is perinatal substance use disorder one-day training that I mentioned that we do in person and virtually. We don't have any scheduled right now virtually. There is the 90-minute 101 to watch, and you'll get to hear real experts do it. We have a substance use recovery support. We have a support group for about everything you can imagine. I'm serious. You just ask me and I'll say, yep, we got one for that. It's amazing. We have one for ADHD. We have one for substance use. So getting better overall, this is all of us, right? We might need medical intervention. You might need medications. Quit saying I'm going to take medication. I'm just going to go for a run. And when I come back, my anxiety's going to be gone. No, it's not. It's still going to be there. You got to do something, okay? You've got to do something. There's no reason to feel rotten. And if you are comfortable with yourself getting a medical evaluation and possibly medications, then you're going to be more comfortable talking to your clients about it, okay? Should not be shame in taking medications if you need them, and there should not be shame in seeing the therapist. But many people say, oh no, I can't go see a therapist. That'd be embarrassing. There shouldn't be shame of going to support groups. And when they say, I'm not a support group kind of person, talk them into it. No, would you try at least one or two? Because see, when they get there, they're going to feel, I'm not alone, I'm not to blame, and I'm going to get better. They see people further down the road. And that's what we do in substance use, and that's what we do in mental health. And when they're going together, we've got to treat them both together.